You walk into a doctor's office. The receptionist says, "That'll be a $30 copay." You think, "Great, that's all I'll pay." 3 months later, a bill arrives for $1,200. And suddenly you're asking, "Didn't I already pay my copay?" Here's the uncomfortable truth. Most people don't actually understand how health insurance works. They think copay means this is the price. They think deductible is just some number on the policy. And insurance companies quietly rely on that confusion. Today, we're going to fix that. Clearly, simply, and permanently. Health insurance isn't designed to be intuitive. It's designed to shift costs quietly, not explain them. Deductibles, copays, coinsurance, out-of-pocket maximums, they all sound like small technical details. But misunderstanding even one of them can mean skipping care because you're afraid of surprise bills, overpaying when cheaper options exist, or worst of all, thinking you're covered when you're not. So let's strip away the jargon and talk real numbers. What a deductible actually is. Your deductible is the amount you must pay first every year before insurance really starts helping. Think of it as a gate, not a discount. Example, your deductible is $2,000. You get an MRI that costs $1,500. You pay all $1,500 even though you're insured. Insurance contributes $0. Only after you've paid $2,000 total that year does insurance step in. Important detail most people miss. The deductible resets every year. January 1st, back to zero. What a copay actually is. A copay is a fixed fee you pay for specific services. For example, $25 for a primary care visit, $40 for a specialist, $10 for generic prescriptions. Copays feel comforting because they're predictable, small, immediate. But here's the catch. Copays do not replace the deductible. In many plans, copays only apply after the deductible is met, or only for limited services. That $30 copay? It might just be your ticket to the visit, not the full cost. The mistake most people make. Here's the most common misunderstanding. I paid my copay, so insurance covers the rest. Not always. In many plans, you pay the copay, and the remaining bill still applies to your deductible. So a visit might look like this. $30 copay at the clinic. $220 bill later because the deductible wasn't met. The copay didn't replace the cost. It just coexisted with it. This is where people feel cheated, because no one explained the rules up front. Deductible versus copay, side by side. Reality. Let's simplify this. Deductible, big number, paid first, applies to major services, resets yearly. Copay, small number, paid per visit or prescription, often limited to routine care, doesn't eliminate bigger costs. Think of it this way. The deductible is the entry fee to real coverage. The copay is a service toll, not the total price. Why high-deductible plans feel so painful. Many Tier 1 countries are shifting people into high-deductible health plans. Why? Because lower monthly premiums look attractive. But the trade-off is brutal. $4,000 to $8,000 deductibles. Insurance doesn't meaningfully help until something serious happens. These plans work well if you're healthy, you rarely need care, you have savings. They're disastrous if you need regular treatment, you live paycheck to paycheck. One surprise bill can derail your finances. When copays actually matter. Copays do shine in specific situations. Frequent doctor visits, regular prescriptions, predictable care like therapy or checkups. A plan with higher premiums but low copays can be cheaper overall if you actually use healthcare. Insurance isn't about paying the least monthly. It's about paying the least total. The one question you must ask your insurer. Instead of asking, "Is this covered?" ask, "Does this apply to my deductible, copay, or coinsurance?" That single question can save you thousands, because covered doesn't mean paid for. The rule to remember. Here's the rule most people never learn. Deductible decides when insurance starts helping. Copay decides how much you pay per visit. Neither guarantees a cheap bill. Once you understand that, insurance stops feeling like a scam and starts feeling like a system you can actually navigate. If this cleared things up, subscribe. Because money problems don't come from ignorance. They come from misunderstanding systems designed to confuse you.